Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome to Digital MD, the podcast for innovators, where we dive into the future of healthcare and translational research. So today we have a great guest. It's Dr. Michael Mina. He's a physician scientist and an epidemiologist who actually played a critical role, especially for the widespread COVID-19 rapid testing during the pandemic. Formerly an assistant professor at Harvard T.H. Chan School of Public Health, Dr. Mina transitioned to industry, where he now is the chief science officer at eMed, a company at the forefront of personal health and diagnostics. He experiences a lot of things. He's gone through not only challenges in academic medicine and funding, but institutional bureaucracy, and is a real-time public health solutions manager. So let's listen to him. And I think, especially as we're talking about today, I want to dive into not only his background, how he transitioned his journey, but also the areas of academic medicine where we're seeing an exodus into some of the private industry. And we'll talk about funding and innovation, work culture, and some of the books that we're reading about personal branding, how you transition your career, and how you think about all of this. So, Michael, we're excited to have you.
Thanks so much. I'm very excited to be here.
Great. So the first thing is, can you share your journey into science, medicine, and the transition into industry?
Well, it's been a long one, I suppose. I was an engineer in college. I went to Dartmouth College, where I started as in engineering, but Dartmouth didn't have the right concentrations for me. So I actually got into both public health and engineering as an undergraduate by cobbling together a bunch of different things that didn't yet exist at Dartmouth. But my foray into medicine was actually ignited in the middle of college, or towards the end. I moved to Sri Lanka, where I became a Buddhist monk, and it's a longer story over there. But while I was a monk, actually, the tsunami hit, the Indian Ocean tsunami in 2004. Afterwards, I lived in a refugee camp for quite a while, for about 6 months, trying to do what I could, with the skill sets I had at the time, which were not many as an undergraduate. But that experience of being in this refugee camp, living in a tent on the beach with a community that mostly lost most of their loved ones, really pushed me to come home and say, okay, how can I use engineering skills in medicine and public health? Just things like watching medicines and all sorts of things boil in the sand, going unused. It's just very clear that there were systemic challenges and systematic problems with how we respond to public health crises. So it set me on a journey of getting into public health. I came home, I actually moved to Nicaragua. I started creating micro businesses out of teaching communities in Nicaragua how to create micro businesses to produce chlorine using solar panels and salt. And, so that was kind of getting into how do we purify water and public health types of things. In the meantime, I applied to MD PhD schools and went to Emory because the CDC was across the street. And so started my PhD at the CDC, did med school at Emory, ultimately kind of changed course, started doing a lot of infectious disease immunology, a lot of mathematics of infectious disease. So more on the biology and immunology side, a little bit less on the engineering for a number of years. Moved around the world doing a bunch of different projects during my PhD, giving me all different experiences. Somewhere in South Africa, a lot was at St. Jude Children's Hospital, but ultimately quite independent. And before finishing med school, I went to Princeton, did a postdoc in mathematics around infectious disease dynamics.
So, underachiever, clearly.
Well, finished out med school. But that actually put me into this whole world of that postdoc at Princeton actually had me, I discovered a few things around measles, which are quite relevant today. Something that's called measles immune amnesia, how measles actually destroys elements of your pre-existing immunological memory. And that was all mathematics. And so then I'm talking to the WHO and others right after this. We published it in Science and it comes out. WHO and folks say, well, how can we think about how to use this research and actually translate it into action? And at the same time, I went back, finished med school, and then went to Harvard to do another postdoc in genetics with a guy named Steve Elledge. And there we actually kind of closed the loop. The first discovery on measles immune amnesia was mathematical. The second discovery was really proving it out so that the WHO and others could potentially use our findings to create recommendations. And so that brought me into a whole world of synthetic biology and really building out assays, very, very highly multiplexed immunological assays to understand and actually measure measles immune amnesia. And
Very interesting.
all of that kind of wrapped in it, like pushed me down this world of public health that was distinct. It was all around measles, all around vaccines, and public health and how we communicate public health issues with the public. Because even though the science was like very hardcore science, it put me in this position to have to deal with talking about measles vaccines all the time, and previous to that, I was talking about flu vaccines. And so that just it brought me into like all these other arenas that I got to see just a different side of the coin from what we usually see in academic medicine. I spent
Yes.
a lot of time talking with and working with vaccine hesitant communities. I used to teach weekend workshops for alternative healthcare workers who questioned vaccines and things. And it's kind of like this very interesting arc
What you're
through the
talking
academic
about,
world.
I just find it, there's so many things I want to ask you about. But I want to highlight that I just hearing from you within healthcare, it's always evolving. I'm hearing that you had mastered not only one, but multiple disciplines in combining your math skills. I like undermine that sounds very junior, but it's actually the ability to synthesize and really think about increasingly data-driven statistics, AI, and predictive modeling. Even in these days, I think about with not only that, but your public health bent and your perspective on that. And top of that, with the clinical medicine, you've created this competitive advantage that I call skill stacking. And on top of that, you intentionally combined what you think is your value, but also what you're passionate about. So I'd love to understand a bit more about how you see that. And then ultimately, after all that education to transition into industry, I've seen and heard a lot of academics say, well, I've done all of this work for 20 years studying and starting a lab or research, and now how do I transition into something that's more profit driven or industry driven, and they're uncomfortable with that. So would love to hear both how you think about skill stacking and then ultimately this idea of transitioning.
I think skill stacking, I love the term. I think it's exceedingly important. It it gives you a different vantages and different viewpoints to tackle a problem that without it, you get, especially in academia, you get stuck down these very myopic tracks and trains of thinking that are it's really hard to get out of them. But if you do have different sets of skills that are oftentimes not skills that would normally be incorporated into each other. So I'm my residency in medicine and is laboratory medicine. And as an example, in the pandemic, where the skill stacking really became important was as an infectious disease outbreak epidemiologist. I'm a vaccine immunologist, and then I'm a laboratory medicine physician. And when the
Mhm.
pandemic hit, it turned out there were very, very, very few epidemiologists who were thinking about testing. And so there was almost no action going on around like, oh, well, what's going to happen? It's a little bit weird to say now because testing became so, ubiquitous. But when the pandemic started, there were no bona fide like epidemiologists really talking about the need for scaling up testing back in like January of 2020.
Right.
And that sort of defined the next 5 years of my life. I had just opened my lab and started as a professor at Harvard in 2019. And so my lab kind of pivoted away from all the immunology stuff to really being able to, develop new tools and technologies and approaches around tests and testing specifically for public health. And without that skill stacking, I think I would have just been like another math model or epidemiologist or just
Mm.
building out clinical tests for the pandemic. But what I found was by bringing together the public health and the medicine, I actually spent years championing this idea that, hey, the tools that we use in clinical medicine can actually become the public health um, solutions that we
Yes.
need for this kind of thing. And,
And,
it was a little
and
bit unique.
can I ask you then, how did you end up transitioning to eMed and being comfortable after having a lab? Did you have to wind the lab down? How did you think about all of this as you moved into a new role?
Um, I was getting exceedingly frustrated with how Harvard was kind of tying us down and sort of preventing us from being very action oriented. So I was starting to look outside of academia. I was advising like the White House a lot around testing, and the chair of my department at Harvard was not thrilled with me working so closely with the White House, despite being like Harvard Department of Epidemiology in a pandemic. They wanted us to just put our heads down and focus on the science and deal with our lab and whatnot. And so I felt a real need to start putting into action for public health a lot of the research that we were publishing. And so eMed had just come about and had gotten cleared with Abbott to support sort of a digital health transformation of rapid tests. And they recruited me down. At the time, I was being recruited to big companies, Amazon and Google and others. It was almost like the moment I put my antennas up, there were like kind of a lot of inbounds. And the
Hmm.
reason I chose not to go to any of those and to go to eMed was I was advised by a good friend who is one of the executives at Thermo Fisher, who just said, look, you could go to a large company, but you're going to be frustrated, especially if you're leaving to be really action oriented. It's like bureaucratic, like you might be better off, especially since you're just getting out of academia. It might be better to get into a biotech, a fast moving biotech with lots of different projects where you can like jump into things and almost like treat it like this the speed at which like a lab moves a little bit. And so
We
I
should
just
come back to
decided
that.
to take a plunge.
I think it makes a ton of sense for some folks. I think sometimes bigger bureaucracies, though, do have different specialties that you can learn from. I actually jumped from startup into Elevance Anthem, and I found
Mhm.
learned a ton
Yeah.
from people that were in the industry for 20 years who did prior authorizations or utilization management. But you're right that I think it can sometimes be harder for those that are fast moving. Clearly, you're very fast moving, and it sounds like it was the right path for you. And we should also talk about, actually, interesting enough, how you made that transition, because you and I have talked about a lot of this before. When you move from academia, there's some challenges. Sometimes I think a lot of wonderful professors are very good at what they do, but sometimes they have hesitations. You do gain a lot of exposure to commercialization strategies, thinking about like the regulatory approvals, product market fit, revenue generation, and all these things that I think a typical academic may not always understand, especially in early stage biotech. Could you talk a bit about that transition too? Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.
Yeah, I do think it's a tough transition. I think it's one that can very successfully be made. But certainly academia doesn't, in general, train people well to leave academia, which makes sense. 99% or more of people who are in academia have never not been in academia. Most
Mm.
professors have never not been in academia, and most students have never not been. So it's a whole ecosystem that's kind of a bubble. I think of it a little bit like a cult at this point. Um, and 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 that means that you don't learn the skill sets when you're in academia. You don't necessarily Academia sort of shuts itself off from a lot of the learnings of industry. There's so much going on in industry in terms of how we operate, how we work, what the regulations are, things like that. And to make that transition, what really helped me is before I made the transition, I was already starting to sit on scientific advisory boards of biotech companies. I was consulting for large corporations like Walgreens and Sanofi and Pfizer. And all those were super part-time. but they were giving me a little bit of an idea of what the bigger world looks like outside of academia. And that I think really did help me to make that transition. But the transition out of
Hmm.
Harvard was hard. Like from a very practical perspective, I made a full transition. A lot of people will kind of go step by step and kind of move out of it over time. In my case, I just relinquished all of my positions at across the Harvard and MIT ecosystem, um, gave back my grants to the NIH, gave philanthropic money that had been donated to lab back to Harvard, probably to go into the ethers of doing nothing there. But
We should talk about
and I
NIH
just
too
that's
with
right.
the current
And so
situation.
I made like like a clean break, which was partly it wasn't the most it was partly in response to just the massive amount of stress I was under with the pandemic and the like it was December of 22 sorry December of 21 at that point. So I'd been working almost 2 years with like practically not a single weekend and 15-hour days. So I think I was also just super stressed and burned out of
Mm.
academia. And so it made sense. Closed up everything and literally just jumped into eMed and started working in to build up new public health programs through eMed for the government. But it was a pretty
Sure.
clean break.
I think so. Two things you hit on too. We should talk about the hybrid model. I'm still a instructor at so working on lecturing and whatnot in Harvard Med School, seeing patients about once a month, especially because you could still do that and dabble in industry. I think some do a clean break. And do you see a lot of this hybrid also occurring, I think, in the future? Because I've heard a lot about it. And then the second thing I want to touch on is how do you help academic doctors and clinicians just transition? Because a lot of times we touch on they lead cross-functional teams, they're more on the clinical operations. Sometimes they have to do investor relations, board management, think about commercial side. So how do you help? How did you develop the executive presentation skills, the engage in non-scientific audiences to help eMed see your value? And how do you lead in this kind of new environment? So
Yeah, so I certainly think the hybrid model is here. I think it's a superpower for people who do it. I will definitely be taking adjunct or some sort of similar position back in academia soon. Um, it's really powerful to have that tie into academia, especially for industry. Industry wants people who are tied into academia in some regard. There's just a
mhm.
lot of benefit to, if for no other reason, frankly, but the way that you're viewed. If you say, I'm an adjunct professor at Harvard or Stanford or MIT or whatever, it immediately conveys something about that individual at that company that's very favorable to the company, just to investors and such. It conveys a level of expertise. So if I were to go back and do it all again, I think probably I would have like kept an appointment of some sort. And there's lots of ways. You know, if people haven't contemplated what it looks like to keep a part-time employment with a or part-time position, oftentimes unpaid, there's so
Mm.
many different ways to do it. I mean, academia wants nothing more than to allow people to stay in there and get no pay. So, you know,
Yeah.
it's pretty easy if you're willing to forego the pay. And usually it's like different orders of magnitude, academic pay versus industry. So it's not a big deal to give it up.
And what
Um,
about the latter, this idea of executive presence? How do you help those that are transitioning be better? Because I've actually had a few biotech CEOs reach out and say, I'm having trouble with my chief medical officer. How do I help them learn the skill sets they need to be successful? Because they manage a lab, they manage a team, but not in the way that needs to drive revenue or commercial value or be able to take risks in the right appropriate way when they're figuring out budgeting and focused on cross-functional stakeholder management.
I think listening, like really do not try to take your academic experience and then like dive into the first executive meeting at a company that you join and and try to dominate the conversation because you're the expert in the room or something on the topic because you're not going to be the expert on the room on the business. And that's where I think really um really listening and really trying hard. For me, it was actually an amazingly difficult transition in some ways to realize that I didn't know how to collaborate, as an example, as an executive of a company. I thought that I was a great collaborator in academia, but it turns out that in academia, there's no real collaboration. There's like kind of collaboration, but somebody's still got to be a last author, somebody's still got to be first author, somebody's got to be,
Mm.
get the grant, et cetera, et cetera. And so academia doesn't actually have people collaborate towards an extremely like towards the equal goal. In industry,
Yes.
you might have a group of executives who all want the same thing. They might want it for different reasons, but they're actually after the exact same goal, which is unique compared to academia. And so I found just listening, sitting in executive meetings, I started getting onto boards, board of directors for public companies, board of directors for private companies. And in all of
Hmm.
those, that's where you really get to hear a lot about investors and how investment thinks VC, how the market thinks, how CEOs think about these things. And I think to fit in, if you will,
Hmm.
as a chief medical officer, as a chief scientific officer, as a physician leaving or scientist leaving academia and going into industry, you have to sort of swallow the pill, if you will, of understanding that at the end of the day, like the company needs to be fiscally responsible and the company needs to be financially resourced. And that means it has to focus on things that maybe as a scientist you might not like, or as a physician you might not like, might not drive you, but the CEO is going to be driven by that. And you're there to support the CEO in a way. They're kind of the captain of the team, and they hired you to come on board as a chief medical officer to really support the commercial interests by bringing your expertise to the table. And I think you have to really listen and understand what does that mean for the industry that you join, whether it's digital health, whether it's deep tech and biotech, whatever
Hmm.
it might be. And to me, the most, even if somebody is not yet fit, or that's the wrong word, but isn't going to be invited to be on the board of directors for a company, what I would
Yeah.
recommend to people is ask to be an observer. People who are hiring people right out of academia do understand that there are limitations to what academics have experienced. And I think oftentimes a CEO or a chair of the board, would be happy to have, it's called an observer for the board, somebody who sits as a not a voting member of the board, but the experience, if you get invited into those conversations, is very, very important and powerful as you think about a longer arc of a career in industry.
Yes, I agree. I think not only seeing the board have discussions, but being on public and private boards, you get such a different perspective on what their concerns are, where they think risks are, and why they make certain decisions. That sometimes when you're not on the board, you're not at that level, and not in the C-suite, you wouldn't have otherwise understood those decisions that have large impacts. I also think the area that you mentioned, just shifting your mindset from publishing grants, tenureship to actually looking at delivering results, thinking about creating scalable impact. That's such a mind shift. You're moving from like long-term theoretical research to thinking about results-driven projects, and how do you communicate that to your CEO or to others in a very effective, collaborative way, where you're pulling in people that don't report to you, but you need support on to tell the story, to engage. I think those are all key things. And I think the thing about transferring skills, there are some also great things you and I have talked about. Sometimes we undervalue some of the great things that academic professors and others already have. Can you talk a bit about that too? Because I do think people that want to make that transition sometimes are just a bit scared, or they're not really sure what they need to do to get there.
Yeah, so thus far we've hit on, what an academic might not know, if you will, or the
Hmm.
experience they might not have when they first leave, and how to maybe get some of those experiences. But what's equally important, in my view, is for academics, especially people with, degree like MD, PhDs, things like that,
Hmm.
MD or PhD, to, people are very, very qualified to join industry. I want people to know who are listening to this, who might be in academia, that academics and academia as an industry has a tremendous ability to make us feel like we're not ready yet for whatever that is. It's like, yeah, do one more fellowship, you have to do one more postdoc, you have to do X, Y, or Z, before you, or you're just a lowly assistant professor. You have to make it to the associate professor, make it to the full. Industry doesn't care about any of that stuff.
Yes.
Industry really wants smart people who can think. And by and large, if you're very well credentialed, whatever that might mean, generally
Yes.
speaking, you probably learned along the way how to think and you're probably predisposed to it and to be smart and give good advice. And so I think it's very important as people are starting down this journey of, well, am I qualified? What can I do? To just,
Hmm.
as a base level, know that you're more qualified than most to take on
I
certain
agree.
roles. Now, you might not have all the skill sets, and there might be some super junior person who never did any graduate school who can, school you in how to,
Make a
lead
PowerPoint,
yeah,
lead
make
a
a
team.
PowerPoint or even like lead just like a little team and be collaborative and, be results driven and things like that.
Yes.
Um, but the expertise you get when you get trained as a physician or a scientist is and especially if you're coming from like leadership in academia as a faculty or beyond that,
Yes.
that's transferable. It is viewed very highly in industry because most people don't have those degrees in industry, and so the moment you enter a room, if you have an MD after your name, doesn't matter what company it is, people will listen to you in your domain of expertise because
Yes. And
the MD is universally understood to be expert, at medicine in that case.
I also think I've given advice where you kind of go after the areas we talked about skill stacking, but also area of interest, right? So if you enjoy research and clinical trials, there are specific areas of more biotech and pharma, less digital health. So overseeing clinical trials, drug development, but other times it's medical affairs if you're interested in the research and commercial applications. And other times it could be more on the analytics side, real world evidence with health econ, big data. I've also seen interesting things such as advising on market strategy, the regulatory hurdles that people are going through versus like product pipelines and early stage biotech, even in venture capital and startups. So I find that there is a quite wide range of interests, and I'm not always encouraging academics to jump into it, but I do think it's worth thinking about where your policy interests are, where your regulatory, where your skill sets are, what you want to learn. And then I myself jumped into the payer side, which was also very interesting. It was a whole new world of understanding how insurance works. So thinking through that more deliberately, I think, is very helpful.
Yeah,
Um,
and one of the things that like what eMed taught me, and I'm very fractional at eMed at this point. I'm worked with a number of different companies. Um, but one of the things that eMed was nice for was it was a very focused company. It
mm,
wasn't in super highly regulated space as a digital health company. It is a regulated space for sure, but it's not like pharma, and
yes,
I think diving into that actually allowed me to have some flexibility to, do a little bit on the regulatory front, do a little bit on product placement and market fit, and really start to sort of get my hands into a few different areas. And then my skill sets, we talked about the skill sets that I got through academia, but then I've kind of taken a very similar approach outside of academia of skill stacking in industry. And some companies might be better than others. If you know that you're somebody who is very happy to have like a singular focus and you can put your head down and just focus on that, then like you mentioned, there might be big corporations might be good for you or like very focused
hmm,
project based approaches. If you're looking for, you know, having a lot of different experiences and getting your hands into a bunch of things. That's like where smaller companies and really will leverage you. If you come in as an executive to a small biotech, you're going to be wearing many hats, which
yes,
is actually quite similar in some ways to academia. And I think it's just the skills that you're building up, the same way that a faculty, like a postdoc, doesn't train you to become a professor. And sort of a similar
it's
thing
true.
happens in industry. Um, and so I found that to be sort of, for me, very, very fulfilling and also helps me define what it is I love to do in industry. Like I found that I really am uncomfortable talking about money. I don't like selling stuff. It's not
Mm-hmm.
not why I ever went into academia. And so I just refuse to I just won't be the salesman. If I'm asked to be a salesman for various companies, like I'll just say, I put up my boundaries and I said, it's not what I'm going to do, but I will absolutely support the salespeople 100%, and I
That's
think that it's
interesting.
important.
Hmm. I I find that very interesting. I do think I tend my current role at Everly Health is to sell and commercialize our strategy, and build relationships with all of our stakeholders. So I do the opposite. I do sell, which is it's an interesting, you're right. And I've seen a lot of folks say they're not as comfortable. So they come in as a CMO, but they want to be internal CEO, not an external front facing sales CMO. I find that distinction to be really important. And you really hit on that. And I think the other thing is thinking about, you mentioned defining success and defining what you want. You and I have talked about this too. It's reigniting your passions to reflect on forgone aspirations, areas that you want to explore in your career direction and thinking through. So I sometimes coach folks on that, thinking about designing your next phase of your career and sort of thinking about a 30, 60, 90-day plan to shift from I enjoy doing these things, almost like a chart. Like I enjoy this type of work, and embracing sort of a growth mindset, like you said, listening first, not needing to prove yourself too quickly, but liberating also yourself from external validation, because sometimes I struggle with that. It's figuring out what decisions will make me happy versus what looks good on a resume or what looks good in front of others. Have you looked into that too? Because I find that is not always talked about, because people assume you have an MD, you must be so proud already of what you do. And I think in academia, sometimes in other places too, even when I was looking at residencies, I was a little bit bashful of my residency isn't a typical residency that people would assume. So just being able to be reflective of what you could do to maximize what you have in front of you and where you want to be.
Yeah, and you hit on it. The shift away from academia, like you very much, there's very clear milestones. There's very clear benchmarks in a way that allow you to demonstrate what skills you've created, or that kind of show to the world, your worth or something like that. Industry is actually quite a bit different because you're
Mm-hmm.
working on projects. You can be invisible. You might be the most important person to the development of a product that nobody in the public ever hears about, which is
Mm-hmm.
quite the opposite from academia, especially in professors, in research, where you're supposed to put your name last on that author list or first in the grants. And, it's kind of a name game in a way in academia. I mean, obviously you have to
Yes.
be doing good work. In industry, you have to be okay actually with kind of removing yourself from the limelight. You could still be on stage, like you could still be giving talks for the company, you could still do all these things. But when it comes to like who's really driving the innovations at a company, a lot of times it's a whole team. You can't really pin it on one person,
Yes.
or one postdoc. It's a little bit nameless. And so people have to get used to that. It's a big change from academia, I think, where nobody wants to be. I mean, maybe some people want their name out there, but it's not the point of a company. The point of a company is not to say, "Hey, I'm the most important scientist that ever lived." It's to say, "Hey, how can we build the best product for the population?"
That's
Or whatever
right.
it might be. And so it's much more nameless. And maybe that's part of why you get incentivized financially better, because you don't get that like ego incentive or something. But I actually think it's a hard change, and some people might find that they miss that from academia, might actually want it, or and some others might say, this is really great. I like being part of a team, and I'm okay, just building the products and seeing that they come to life.
Mm-hmm.
I feel like I went off on a tangent there. I can't remember the initial point of why I was saying that, but I think it's an
Well,
important point that I actually had to get quite used to.
I think so too. I mean, just coming back to why this is an important conversation now is that we're looking at federal funding with NIH and others being potentially in jeopardy for some of the clinical medicine and research and development that we're thinking about. So I feel like it's a timely topic for a lot of academics and those that are thinking about what's the next step. Do we consider other alternatives? So I really appreciate the time to talking about this. So again, thank you for being here today, Michael. Before we wrap up, we always ask our guests for their hot take on 4 or 5 key questions. So are you ready?
I'm ready. Yep.
Okay, great. Best advice you want to give?
Wake up every day and do what it is you want to do. And if you're not happy with what you're doing, change directions, even if it means change careers.
Great. How about the hardest challenge and how did you overcome it?
My hardest challenge was probably For me, honestly, it was probably the decision to leave academia and give up sort of this limelight of academia and becoming a sort of a pseudo star, in that space. And to overcome it, I really thought very long and hard about um, what I wanted to do with my life. And at that point in time when I left, it was I want to make sure that the words that are coming out of my mouth and the research that I'm doing is actually saving lives, at a time when 4,000 people a day were dying of a pandemic in the United States. And I
Mm,
just worked hard to ensure that I was following my values.
great. What about the most exciting thing you think about in healthcare innovation right now?
I mean, it sounds cliche at this point, but AI, like it's just so hard not to. I use
Mm-hmm.
it to engineer new devices. I use AI to come up with new digital health platforms. I use it to write contracts. I mean, the pace of everything is just so fast. Um, it's just exceedingly exciting, and it's scary and it's exciting and it's thrilling in many ways about like what are our careers going to look, what are our jobs, what is
I
an MD
agree.
going to do for us in the future? It's just thrilling to me.
Everything's going to be augmented for us. Okay, so if you could have any superpower in the world, what would it be?
Ooh, I think it would be to uh, I have two. So
Okay.
so one would be in the vein of our skill stacking. It would be to be able to have expertise across a huge array of different engineering disciplines. I feel like that would allow me to, really create the change that I want to see in the world in a more efficient way. The other would be really understanding motivations of people.
Oh,
And,
yes. Yes.
that's from business, but actually where I come from for that is actually I've been so moved by conversations with vaccine hesitant people and understanding where barriers to healthcare are that maybe aren't so apparent all the time. And I think, just really understanding where people are coming from when they make decisions that don't necessarily make sense to us, I think is just incredibly important.
Very helpful. And so, anything you want to share that you feel like we have missed? Last thing that you want to give to the audience?
I just want to reiterate that for people who are thinking about leaving academia, um, it is a huge world out there. There are jobs to be had, especially at this moment in time when the NIH is cutting funding and all these things. People are scared about, am I going to have a job in academia? I think I want people to know that the world is huge. Like when you get out of the academic bubble, there are huge numbers of companies with huge numbers of employees, and you're qualified. People will find jobs. You have to work a little bit at it, but it's not like, there's a lot of different jobs. Oh, and the other thing is what's really different about industry than academia that I really hope people know because it takes a little time to realize is that people move jobs all the time in industry. In
Oh,
academia,
yes.
people don't. You might stay, if you're a professor, you might have one move in a career, go from one university and then, after 8 years, move to somewhere else and retire there. Industry, people move jobs every 2 years, every 4 years. It's super, super normal. And so I would argue for people, especially if you're just leaving industry, don't put too much thought into finding the perfect. I mean, if you're just leaving
I
academia,
think
don't
that's
put too
great
much thought
advice.
into it. Just
Yes.
jump it, do it. If you don't like it, you'll find another job. And it's normal. It's not shamed. It's not a shameful thing to move like it is in academia. You're a little shamed if you leave.
Two things I want to add to that. I think in academia, you've planned a road and you sort of know what ultimately is tenure and other things. In industry, especially in business, coming from business school, and my friends change jobs every 2 years, and they're in healthcare every maybe 1 year. And so it's a normal thing. It's not shunned because you're also skill stacking when you go through different companies. On top of that, I also think in industry, you're actually told a lot of what you're really good at. So you feel better about yourself each time because the ethos is great job on that presentation, great job on this. I think in academia, there's a bit of all the academics I talk to, it's like you're constantly told no, whether it's grants or with other promotions or other things. And in industry, there's one tweak that I would say I wish academic was more, um, there was a lot more hurrah and great job on getting that grant or great job that you don't always see.
That's right.
So
Yeah, I agree.
there's a bigger world out there. Well, thank you so much. Listeners, for more on Michael's work, you can follow him on LinkedIn. We'll link it in the show. And we also hope today's conversation has sparked your curiosity and inspired you to explore further. Thank you again for coming, and thanks for joining us. Until next time, keep on innovating.
Thanks so much.
Thank you. Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.